All children have medical needs that should be met with help from both parents and healthcare providers. Children placed for intercountry adoption often have more needs due to a lack of consistent medical and prenatal care prior to the adoption. Many of these children also have specific medical needs and conditions that require additional attention. Proactive treatment of healthcare needs as early as possible can help decrease the prevalence of future medical, emotional, and mental health-related issues. Children who are placed for adoption should have primary care pediatric providers with competence and experience in working with children who were adopted internationally. When this is not possible, parents can supplement pediatric care by maintaining ongoing consultations with adoption-focused medical clinics.
There's nothing wrong with using your local pediatrician or your family physician. However, whenever you're reaching out for information, you want to talk with somebody who's knowledgeable, experienced, and available. And typically, adoption medical professionals are those people.
We are all involved in adoption. You know, many of us are adoptive parents. Some of us are actually adopted persons. And therefore, we know what families are going through, and we know what the long-term issues are in adoption.
Children with specific medical special needs should be assessed and treated by specialists. Primary care physicians and pediatricians can help provide referrals to these specialists. Adoption-competent medical providers can help parents understand the connection between medical health and other factors the parents and children are dealing with after the adoption. These include speech development, fine and gross motor development, emotional development, sleeping issues, and feeding issues. Prior to completing an intercountry adoption, prospective adoptive parents receive what is often called a referral. At a minimum, these referral documents should include pictures, sociobiological information, history, and medical reports. They may include videos, educational reports, and other child-specific information. Having an experienced, adoption-competent medical professional provide a pre-placement medical review can be an invaluable way to better understand the referral documents that parents receive.
And we can look at it and say, some of this information is very helpful, others maybe not so much. So the helpful information is anything that's objective. You know, measurements, milestones, videos, photographs, laboratory tests. What we want to do is to give them an idea of what it was going to be like to parent that child.
Sometimes it's a one-time contact with the adoption professional where the prospective parents have specific questions that they want answered. Other times, it can be an ongoing relationship where the parents have access to the adoption professional for as long as they need.
The completed pre-placement medical review usually includes an expense paid directly to the clinic conducting the assessment. The review is strongly recommended as a relatively inexpensive way to get valuable information. If there is a nearby international adoption clinic, it may be the best option for families, as they will have it as an option for visitation after they return home. Pre-placement medical reviews often happen remotely, meaning the prospective parents do not need to be at the clinic in person. The prospective adoptive parents can email the information to the clinic and receive both a written report and phone consultation afterwards. When it comes to a child's referral information, parents should be prepared for having limited or missing information. Prospective parents have a right to request additional information and should work with their accredited adoption service provider to make these requests. Prospective adoptive parents should obtain as much medical information as possible. Often, the pre-placement medical consultations will help identify the information that's needed, things that may be useful in making an informed decision to accept or decline a potential adoptive placement match. Most children who are placed for intercountry adoption spend a portion of their lives in an orphanage. They are sometimes called a children's home or a social welfare institute. These residential institutional settings may negatively impact children, with both short-term and long-term consequences. Institutionalization is a word used to describe the impact on a child of living in an institution.
Within institutional care settings, there's a whole spectrum of issues that come up, and it depends on how depriving the environment is, how long they've spent there. When you live in an orphanage, you suffer from social deprivation because there are 5 or 6, 7 or 8 other children vying for the attention of that caregiver. So therefore, that caregiver cannot deliver contingent care when that child needs it, in order to promote normal brain development.
The physical conditions, caregiver supervision, and resources, as well as the length of time a child lived at the institution, all of these factors increase the risk of adverse impacts from institutionalization. Family foster care settings may also present similar risks and impacts upon children as those found in institutional settings. These impacts may be multiple or unresponsive caregivers, which made it difficult for a child to form a bond or attachment with a caregiver. An exacting routine or schedule designed to meet all residents' needs while not allowing for a child's unique needs to be met. A lack of privacy and lack of personal belongings. Inadequate conditions, including unsafe and unsanitary physical surroundings, diminished health care provision, lack of nutritional provision sufficient to meet the developmental needs of a child. This leads to vulnerability to malnourishment, sickness, and impaired physical and cognitive development, lack of experience in a family environment, greater vulnerability for neglect and abuse, including physical abuse, emotional abuse, and sexual abuse. Children placed for adoption often do not have adequate nutritional intake prior to placement.
The short-term effects are typically immediate growth, retardation. Sometimes it's not so obvious, other times it's extremely obvious that the children have been malnourished because they're so small. The long-term effect of malnutrition is, again, it depends on the severity of the nutrition. The children who come home the most malnourished and grow the fastest are those kids who are most likely to have longer-term problems with not only intellectual development, behavior, as well as those kids sometimes enter puberty earlier.
Malnutrition can impact a child's growth, development, cognition, and other health-related issues. Severe cases of malnutrition can have long-term and even lifelong impacts on children. With intercountry adoption, some of the common consequences of malnutrition include micronutrient-oriented deficiencies such as anemia, an iron deficiency, iodine deficiency, vitamin A deficiency, and others. These deficiencies may impact physical growth, hormone production, cognition, and other forms of childhood development. Undernutrition leading toward low weight, stunting, or wasting. Poor nutrition will affect not just their physical growth and cognition, but also how children feel and behave.
I've been to many, many, many orphanages and generally find there's lots of food around. So why don't kids grow well? Well, kids don't grow well for a couple of reasons. One is when they are deprived of social interaction, they kind of give up feeding. In fact, there was a whole syndrome that was named early in the 20th century by pediatricians looking at children's hospitals at that time that was called hospitalism, where these kids kind of gave up the will to live, stopped eating, and actually died because they didn't have the social interaction that they needed.
Assessing a child's nutrition should be done by a professional as early as possible. After adoption, when children are exposed to a nutrient-rich environment, it may take many months or even years for their bodies to reach adequate nutrient levels. Children exposed to maternal substance usage, either in utero or while breastfeeding, may be impacted by these substances in a variety of ways. There are both legal and illicit substances that can adversely affect children exposed to them. This includes, but is not limited to, tobacco products, illegal drugs, certain prescription drugs, as well as alcohol. Children placed for intercountry adoption may not have received adequate prenatal care. Many children are unable to stay with their birth families as a result of parental substance usage and addiction. These factors make children more vulnerable to exposure to substances that can impact their growth, development, cognition, emotion, and behavior. Sometimes this results in diagnosable conditions such as fetal alcohol syndrome or neonatal abstinence syndrome. Other conditions such as ADHD, cognitive disabilities, and poor physical health may be the result of such exposure.
And the major one is prenatal alcohol exposure. And we're looking for three things in terms of evidence that that child may have been exposed to alcohol. One is characteristic facial features. The second is a small head size in terms of an infant or some degree of cognitive disability in an older child. And whether or not that child is stunted in terms of their growth. So all of those things occur with full fetal alcohol syndrome.
Maternal substance usage can have short and long-term impacts on children. Working closely with medical professionals facilitates the diagnosis and response to the children's needs arising from such exposure. Children are often very resilient if they are given the proper resources, a healthy environment, and the guidance of competent medical and other professionals. They can often mitigate or even overcome the adverse impact of substance exposure. Environment toxins such as air pollution, lead poisoning, mercury poisoning, household and industrial chemicals, and contaminated water are a few of many potential toxins that can adversely impact our health.
Probably the most common environmental toxin that we think about is lead poisoning. In lower resource countries, lead poisoning is still a significant concern for all children living there, particularly children in orphanage where they're not necessarily screened or they're not monitored while they eat. Sometimes they don't even have symptoms, so it's impossible to know if they're lead poisoned until they come home. And when they come home, lead screening is one of those things that we do as soon as they walk into the door.
Children are often more susceptible to these toxins. Their vulnerability can come from their underdeveloped immune systems, poor sanitary conditions, the lack of resources to promote health and safety, and the obvious deficit of not having parents to help prevent or mitigate exposure to these toxins. Sometimes these toxins are unseen and unknown, making it difficult to prevent, diagnose, and treat their victims. Some of the consequences of children's exposure to toxins can include respiratory disease, heart disease, bacterial infection, reduced brain development leading toward lower IQ, reduced immune response, and the disruption of typical growth and development. There are other toxin-induced conditions, but these are the most common. It is common for families pursuing intercountry adoption to decide what, if any, known medical special needs they are open to accepting as part of their match. When making these considerations, parents are encouraged to consider both short and long-term impacts on the family. Consider the impact on any other household members, especially other children in the home. You should never make a decision based upon guilt or shame. Thoroughly research the medical conditions you are open to being matched with. Research the treatment needs of medical conditions and understand the financial, time, and other resources needed to meet the needs of that condition. Learn what coverage is available to your child via your family's health insurance. Confirm the eligibility, timing, and process for adding a new child by adoption to your insurance plan. Utilize adoption-competent social workers, your accredited adoption service provider, and adoption-competent medical professionals to inform you prior to your decision. Making the decision should be about the right fit for both the prospective adoptive parents and the prospective child by adoption. As part of every intercountry adoption process, prior to getting a visa to enter the United States, children will be required to have a medical examination by an approved panel physician. These are medical professionals designated by the Department of State to perform examinations on potential immigrants. The visa medical examinations often include a physical examination, a TB screening, vaccinations, and blood tests for older children. The purpose is to screen for certain medical conditions, such as tuberculosis and other communicable disease. If these conditions are present, the child must either undergo treatment or receive a waiver. Before parents travel internationally, it is recommended they consult a medical provider to ensure they are up to date on vaccinations and follow any region-specific medical advice. Consult with your adoption-competent medical provider about any over-the-counter medications you may want to bring for the child you plan on adopting. Prior to traveling, it is recommended you schedule the pediatric medical evaluation for shortly after your return. You should also arrange for health insurance so that it is available for your child as soon as you are back in the United States. This training is not designed to cover all medical considerations prior to an intercountry adoptive placement. It is your responsibility as prospective adoptive parents and the responsibility of the accredited adoption service provider to ensure that you have received child-specific and country-specific training prior to traveling for the completion of the adoption process. While there will always be unknowns, the more information and training you can receive in advance, the better prepared you will be to meet the needs of the child who will be joining your family.